Oh, hello there. Yeah, come on in. How are you doing? Take a seat. Great. That's awesome. Can you tell me if you have been experiencing any pain? Alright, that's great. Let me just pull up your file. Is it? I haven't been outside since, well, I came in around 6 a.m. so it wasn't raining, but yeah, there's quite a lot of traffic as well. Did you come by bus? That's always the best option. I always take the car. I have the private parking, but for patients it's always terrible. Alright, great. So I'm checking in here. So last time, oh yeah, I remember. Last time we made the incisions for the treatment, correct? How is that part of the skin going? Great. Any redness? Oh, that's good. No, that's normal. That's totally normal. It's actually a good sign. It means that the skin didn't react to the treatment that we did before. Have you been taking any of the pills? Okay. Do you remember the last antibiotic that you were taking? Right. Do you remember more or less? Okay, I know that one. There we go. Okay, that's great. So today we're gonna be cleaning all that area of your skin. Yes, exactly. Last time we created the little incisions so that we could reach, and we just had to wait this week to see if anything would happen, because sometimes the skin does react in a bad way to the treatment, so we always need to test it out first. Yeah, but anyway, I'm gonna examine today to start with, and then I'm gonna proceed with the cleaning, and everything will be finished today. Hopefully your skin will start to heal properly in the next few weeks. Great. Alright, so whenever you're ready, if you just go to that little door on your left, you can leave your stuff in there. You just need to remove your shirt. I'm gonna prepare for the procedure. We're gonna do it here. So yeah, whenever you're ready, it won't take more than a minute. Okay? Yeah. Don't worry, it's not gonna hurt. Right now, for this procedure, like on the last one, we're gonna use a cream that's basically gonna numb the area that we're gonna be working with, so that you won't feel anything. Yeah, sometimes it gets a little bit uncomfortable for the patient, so of course you don't have to worry about that. Alright then, so whenever you're ready, I'll see you in a minute. Alright, so are we ready to start? Yes? Great. So, just gonna start by examine this here. Alright, great. Yeah, everything looks There's no redness, which is great. So I'm aiming to clean at least this front row today, and then if we have some time I might start on these ones, but we're definitely looking at 2 sessions here. Alright? Great. So I'm just gonna start by putting a towel underneath just to make sure you're comfortable. Okay, great. And so I'm gonna remove this protection that we put last time. Okay. Alright, that's great. So it all seems pretty much as I was expecting. There's a few of these that actually started closing, which is totally fine. So I'm just gonna try to remove the excess on all of them first, but the most deep cleaning will be on this front row, and then the other ones will have to be on the other session. Okay, great. So I'm just gonna start by cleaning with this alcohol prep pad. It is a little pad that comes already with an alcohol solution, and it basically helps cleaning the area so that there's no risk of infection. Okay. Alright. Let's remove that little pad. As you can probably smell, it is a very, very strong smell of alcohol. This will basically help us keep all these small incisions clean, make sure they don't get infected. Alright, so just gonna run through all of them. Alright, now that we put the solution, yeah, the smell is quite strong, isn't it? Just gonna take one of these pads. Just gonna remove the excess. Okay. Great. Alright. And we're ready. Just gonna apply the anesthetic. Okay, you won't feel a thing, don't worry. Okay, so for this part I need you to be in contact with me. Just let me know if you feel anything. Just gonna start by taking a little bit of this product, which will basically make all this area feel very numb, and you won't feel the procedure. Alright, for this I'm just gonna use this syringe, and we only need it until number 2 right there. Okay, so I'm just gonna take this one, gonna pull it until I have liquid on number 2. So you can see the liquid is only on number 2. So just gonna apply it. Great. Close this one. I'm just gonna put this glove on. Okay. So that I can actually apply it everywhere without my hand being numb. In a few seconds, you will probably experience a little tingling sensation. It's completely normal. It means that it's working. You starting to feeling it? Great. Gonna remove this one. Just gonna let it be for a few seconds. Are you starting to feel numb? Yeah, that's normal. Just gonna remove this excess from here. If you're uncomfortable at any moment, please let me know. Okay, I'm gonna be talking with you during the whole procedure, trying to make sure you know what's happening. Alright? Yes. We actually thought about having some music here, but a few of our patients are not very keen on that, so we decided to just stay in silence. Yes. Well, there's a lot of traffic outside, so that is already quite a lot of noise. But we can still talk, right? Okay. Alright, so do you feel this? Great. Just gonna take this little kit with tools that I'm gonna be using during the procedure. Just gonna show you what we're going to use, okay? Alright, so these are all the little tools. I'm just gonna remove them one by one. I'm gonna start to put them here so that I can use them when I need. Alright. Okay. But we'll leave these ones here. Okay. Great. So I'm just gonna start by pitching a little bit here and then, so to make sure that you're not feeling anything. Okay? Great. Do you feel this? No? Great. What about this? No? Nothing? Okay. Great. That's a good sign. It means it worked. So we can start working on these. Okay? So what I'm gonna be doing, I think I'm just gonna clean them all first. Just take the excess with my fingers first, and then I'm just gonna clean a little bit more deeply with the tools than these front ones. Okay? Great. Alright. So just gonna need a little gloves. gonna start. Ready? You shouldn't feel a thing. Alright. Oh. There we go. That's great, actually. It's really, really good. Alright, see? We have quite a lot coming out, which is great. That's exactly what we want. I'll just put this on the side. Alright. And that's exactly what I'm gonna be doing. Just gonna take the excess. Alright. Just actually gonna pick this one up. That's great. Let's go for this one. It is very satisfying, isn't it? Yeah, I agree. Alright, let's go this one. Alright, sorry if I'm making too much pressure. It's just because we really want to go and remove as much as we can. Alright, let's go for this one now. Some of them are harder than the others. We just need to keep trying to remove anything that's left, okay? Great. Alright. On this one here. Some of them seem to be quite empty, which is actually good. Exactly. But then we have these ones that have quite a lot, as you can see. There we go. Yeah. Let's just try to remove these. You're doing great. No worry. Alright. We should be ready to start on this front row. Okay? So we're gonna clean this floor a little bit more deeply, just to make sure they are really clean. See, we still have quite a lot left, and we don't want that. We want to remove as much as we can today, so that the next session goes very smoothly and we don't have to do much. Okay, so you can see there's quite a lot in there. Here we go. Okay. Do you feel anything? That's great. Yeah, sometimes anesthetic might not work, but that's very, very rare. And even if it doesn't work, we usually just apply it again and it it's all good from that. Yeah. Okay. As you can see, we're removing most of it, which is great. I just want to make sure it is properly clean. Exactly. Let me just change this bed. It's getting quite full. Okay, we have a new one here. You can just keep going. Let's try here. It's kind of satisfying, this procedure, because you can actually see it and it's like very relaxing. Although some patients don't really like to watch, so that's totally fine. Not everyone actually enjoys this type of things. Yeah, just need to be aware of those patients. Exactly. Glad you're okay with it. At least I can talk and explain everything that is happening, and you can also see. Yeah. We're almost done here. I really just want to leave these 4 clean for today, and then we're gonna book another session for next week where we will clean the other ones a little bit more. Exactly. These are almost done. As you can see, there's quite a lot in them. I'm quite happy that we made these incisions, which is so much better to clean. Alright. So, I think that is pretty much it for today. You just check. Yeah, they are pretty okay right now. I don't think I want to force any more. We don't want to irritate the skin. So we're basically gonna finish here for today. I think we did quite a lot today. Just wanted to remove as much as I can. These ones are pretty clean already, so that should be fine. Alright. So as I said, I really don't want to be too harsh on your skin today. So I think we're gonna leave it. Just gonna give it a good clean now. Just gonna apply this. Okay, just gonna put a little bit on each one, making sure it heals properly. And then next time we will finish. Okay, let's just take a clean path. So what I'm gonna do today is I will basically cover this so that you can just do your normal life during the week. Okay, and if there's anything, if you feel uncomfortable or something, I'm also gonna give you some pills today. Okay, and you can also call. Alright, that's good for today. Just gonna take this one now, and we're gonna just cover it, okay? Alright, so let's just put it all around, make sure it's all covered so we don't get anything here, okay? We just don't want to risk an infection. Exactly. Alright, we can leave this one here. Let's make sure it's well wrapped up. Just gonna apply a little bit of this tape that helps keeping everything in place. Okay? Just gonna put a little bit here. And a little bit there. Alright, that should keep it in place. Okay? How are you feeling? Good. Yeah, the anesthetic should pass in like 2 hours, so don't worry too much about it. Okay? You're doing great. This session was actually very, very good. So I'm looking forward to the next one because we'll be able to actually do like the final part of the treatment, and you will probably get rid of these very soon. Yes. Alright. So in the meantime, just gonna give you these pills. They are very good to help you if you start feeling any discomfort. You just gotta take 2 per day, and that should keep you going, okay? Yeah, I'm gonna give you this bottle you can take with you today, so don't worry about it, okay? Right. So I guess that's all for today. Do you have any doubts? Yes. I understand. Well, we're gonna book the appointment. If you just go to the reception desk, they will find a date that actually suits you. It will be around next week, towards the end probably. So you just need to book the date, and we should finish this next week. Okay. Alright. Well, thank you so much for coming today. I think we made a lot of progress. Looking forward to meeting you next week. And until then, you know, if you need anything, okay, just contact me. You have my email as well. You can simply send me an email if there's any problem. You can also send me some pictures if anything happens, okay? Great. Alright then. So I will see you next week. And until then, I hope everything is okay. Alright? Okay. Bye bye then.